So a question you might have is, it appears that hypothermia is a promising therapy for term babies. Should we consider it for the premature infants? This is a single center observational retrospective study that tried to answer that exact question. For babies less than 36 weeks gestation with hypoxic ischemic encephalopathy, received whole body hypothermia in a single center between 2007 and April of 2015. And again, the primary outcome was death or moderate to severe neurodevelopmental impairment. They had 30 infants, and these were the results. So the median age was 35 weeks with a range all the way down to 33 weeks. The birth weight was 2,575 grams on average, with a range anywhere between 1,850 and 4,840 grams, and a first postnatal blood gas on average of 6.81, so quite distressed population with a range of 6.58 to 7.14. Complications were frequently seen in this population. Coagulopathy was seen in 50% of the babies, early clinical seizure in 43.3%, arterial hypotension in 40%, persistent metabolic acidosis in 37%, and thrombocytopenia in 20%. Outcomes: 4 infants died before or soon after discharge. 18 surviving infants had follow-up data. 7 of them had moderate to severe neurodevelopmental impairment. Death or moderate to severe neurodevelopmental impairment occurred in 50% of infants with known outcomes. So the conclusion from this single center study: large randomized trials on efficacy and safety are needed in this population, as the incidence of complications in the combined outcome of death and neurodevelopmental impairment is concerning. So a summary of my presentation: evidence-based strategies to optimize neuroprotection in the premature. Number 1, avoid premature delivery if at all possible. Number 2, use antenatal steroids to reduce the risk of an interventricular hemorrhage. Number 3, great evidence to support the administration of magnesium sulfate to the mother threatening to deliver her baby prematurely. Delayed cord clamping for the spontaneously breathing premature infant. And although indomethacin and erythropoietin have shown some promise, neither have sufficient evidence to support their use now. And then hypothermia to 33.5 degrees for 72 hours for the late preterm infant, defined as 35 weeks and above. I thank you for your time. I thank you for your attention. If you have any questions, please do not hesitate to send me questions. I love to correspond with people all around the world. Feel free to take a picture of my email address and email me anytime.